Hi, I'm Darwin Geraldis, and this video discussion is for PTA 214 clinical assessment, week 3. So for week 3, it's all about manual muscle testing, MMT. So manual muscle testing is it is used as a means of testing and grading muscle strength based on gravity and manually applied resistance. Manual muscle testing is graded from 0 to 5. 0 when there is really no activity, and 5 is when it's representing normal. 5 is basically the patient is able to perform the motion, the full range of motion, against gravity with maximum resistance. So in manual muscle testing, we don't grade individual muscles. It is actually grading all of the muscles that is involved in a particular movement. So let's go look into the grading system. So I've mentioned earlier that it's from 0 to 5. So 0 has no activity at all. Muscle grade number 1 is called trace activity. Muscle grade number 2 is considered poor. Muscle grade number 3 is fair. Number 4 is good, and number 5 it's normal. So let's taking a look at going deeper into details. Grade 5 is when the therapist cannot break the patient's hold position when applying maximum force. So that's the key word there. For grade number 5, it involves maximum force. If the person is able to do the range of motion, able to hold it there, and then with a maximum resistance applied, and still patient is able to hold there without breaking, that is a 5, and that is the highest grade level for manual muscle testing, and it's considered as normal. Now, grade number 4 is used to designate a muscle group that is able to complete a full range of motion against gravity, but the patient is not able to hold the part of his body against maximum resistance. So the muscle gives against maximum resistance. Now going to muscle grade number 3, is it it's a test based on an objective measure. The muscle or muscle group can complete a full range of motion against only the resistance of gravity. So let's say, for example, the motion is shoulder flexion. So I'd be able to move my arm all the way up and then be able to hold it in position. So this is considered a grade 3 if I'm able to do that and hold it in position without anyone pushing me up, applying a resistance or at the end of the movement. And moving on to grade number 2. So this grade number 2 is characterized by only completing the full range of motion in the position that minimizes the force of gravity. In my video later on, you would notice that I have put Sarah in side-lying position. So her arm, which I'm gonna ask her to move to flex her shoulders, the movement of her arm would be horizontal to the ground. That way it's minimizing gravity. And that's a grade 2 because we'll show that the patient was able to move her arm all the way to the end position, the end range. And muscle grade number 1, it means that the therapist can detect visually or by palpation some contractile activity in one of or more of the muscles that it's involved in the movement being tested. So meaning as I assist the patient, because the patient is not able to move it by by himself or herself. So as I move the hand, I could feel some of the muscles um, contracting, not necessarily being able to move um, the particular part of the body, but you could feel it palpating or contracting. There's some activity there. And moving on to grade 0, which is totally nothing, no movement at all, no visual. You don't see anything movement in the muscles, and you don't even feel anything. So those are the grade level for manual muscle testing. Hi, so I'm going to be doing a manual muscle testing grading with my partner here, Sarah. So since she looks like a healthy person, doesn't look like she's in some kind of a pain or muscle contraction limitation, so I'm gonna start testing her for a muscle grade of 3, which is also considered a fair. Okay, Sarah, so the action I'm going to be testing her on is flexing her shoulder. So Sarah, if you could just flex your shoulder as far as you can. Okay, so this I would have to grade her for a 3 because she was able to do the full range of motion against the gravity. Now I'm gonna try and put a moderate pressure resistance on her arm, and if she's able to do that, then we're gonna be grading her a 4, which is good. Okay, I'm gonna hold that in position. I'm gonna put some kind of resistance on you. Okay, now relax. So since she was able to manage to keep her arm in that position with moderate resistance, that will be graded a 4, which is good. Now let's try and see if she would be able to hold it in position with maximum resistance. Okay, Sarah, do the same movement again. Flex your shoulder all the way up. Okay, hold it in position, and I'm gonna put maximum resistance. Okay, now you can relax. So with what Sarah showed, she was able to hold her arm in position with maximum resistance, so I would say she's a grade 5, which is an okay. For this next video, I will be showing how a manual muscle test grade of 2, 1, and 0 looks like. All of these muscle grade are done on a gravity minimized position. So Sarah here will be in a sideline position, and the movement of her arm would be horizontal to the ground. So a grade 2 means the patient is able to do the movement, a complete range of motion, with the gravity minimized. So I'm going to be guiding her arm, and she would be able, the patient should be able to do the full range of motion without your help. And that would be a grade 2. Now go back to the original position. A grade 2, by the way, is considered poor. Now the next manual muscle testing grade is a grade 1, which is also called a trace. So the characteristic of this manual muscle test grade is the tendon or the muscle contraction is felt, but there's no visible movement. So I'm gonna have to help the patient do the range of motion. So I will have to lift her arm and move it all the way, don't do anything, all the way up to the end position. So she didn't do anything here, but I feel like there's a movement in the tendon or the muscle, but she's not able to do anything. She's not able to move it by herself, so I have to do it for her. That's a muscle grade 1. And muscle grade 0 is totally nothing. Like, she's not able to do anything, and I couldn't feel any movement of the muscle or tendon. So it's really passive range of motion. That's a 0.